Imagine you're talking to someone normally, and suddenly one side of their face starts to droop. Their speech becomes strange. One arm becomes weak. These could be signs of a stroke. A medical emergency where part of the brain suddenly stops receiving the blood and oxygen it needs, and every minute can matter. So, what actually happens inside the brain during a stroke? Your brain needs a constant supply of oxygen and glucose carried by your blood. Unlike many other organs, brain cells have very little ability to store energy. So when blood flow is interrupted, brain cells can begin to become damaged within minutes. There are two major types of stroke: ischemic stroke and hemorrhagic stroke. Although they are very different, both can cause serious brain injury. About most strokes are ischemic. This happens when a blood vessel supplying the brain becomes blocked, usually by a blood clot. Think of it like a traffic jam inside a tiny blood vessel. Blood can't get through, and the brain tissue beyond the blockage begins running out of oxygen. The second major type is a hemorrhagic stroke. Instead of a blockage, a blood vessel breaks and bleeds into or around the brain. The blood can damage brain tissue and increase pressure inside the skull. So one stroke is caused mainly by blocked blood flow, while the other is caused by bleeding. And because the treatments are different, doctors need to determine which type is happening as quickly as possible. But how can you recognize a stroke? One of the easiest ways to remember the warning signs is FAST. F for face, ask the person to smile. Does one side of their face droop? For arms, ask them to raise both arms. Does one arm drift downward or feel weak? S for speech, ask them to repeat a simple sentence. Is their speech slurred, strange, or difficult to understand? T for time. If you notice these symptoms, time is critical. Call your local emergency medical service immediately. Other possible symptoms include sudden vision problems, severe dizziness, loss of balance, confusion, or a sudden severe headache, especially with a hemorrhagic stroke. And importantly, symptoms can sometimes disappear after a short time. That doesn't necessarily mean the danger is gone. A temporary episode could be a transient ischemic attack, or TIA, which can be a warning sign of a future stroke. Once a person arrives at the hospital, the first priority is to determine what type of stroke is happening and how much brain tissue may be affected. Doctors usually perform brain imaging, commonly a CT scan or MRI, depending on the situation and available resources. For an eligible person with an ischemic stroke, treatment may include a clot-busting medication given within a specific time window. In some patients, doctors can also perform a procedure called mechanical thrombectomy. A catheter is guided through the blood vessels to the blocked artery, where specialized equipment can remove the clot. But these treatments aren't appropriate for everyone. The decision depends on factors such as when symptoms started, brain imaging, the location of the blockage, medical history, and other risks. For a hemorrhagic stroke, treatment focuses on controlling the bleeding, reducing dangerous pressure, and treating the underlying cause. In some cases, surgery or other procedures may be necessary. That's why waiting at home can be extremely dangerous. Surviving a stroke is only the beginning. The brain controls movement, speech, vision, memory, swallowing, balance, and many other functions. So the effects of a stroke depend heavily on which part of the brain was damaged. Some people may have weakness on one side of the body. Others may have difficulty speaking, walking, swallowing, remembering, or performing everyday activities. The brain can sometimes adapt and reorganize after injury. This is one reason rehabilitation is so important. Depending on the person's needs, recovery may involve physical therapy, occupational therapy, speech and language therapy, and other forms of rehabilitation. Recovery can take weeks, months, or longer, and every stroke is different. A stroke isn't simply a problem with the brain, it's a race against time. A blocked blood vessel can deprive brain cells of oxygen. A ruptured vessel can cause bleeding and pressure. And the sooner the person receives appropriate medical care, the sooner doctors can determine the cause and begin treatment when possible. So remember, face, arms, speech, time. If you suspect a stroke, don't wait for the symptoms to disappear. Seek emergency medical help immediately, because when it comes to stroke, every minute matters. If you found this video helpful, don't forget to like, subscribe, and share it. You never know when this information could help save a life.